Hello, the following video is going to demonstrate various concepts outlined in the Kinesiology 3223 Biomechanics online course at Georgia College, instructed by Dr. Mike Martino. These concepts will focus on performing anthropometric measurements and examples of anatomical terminology. Information presented in the video is based on the information outlined in the course and my general comprehension. I hope you enjoy. Thank you.
Today we're going to be taking the waist to hip ratio measurement. We'll start with the waist measurement first, and what you'll need to do is you'll find the top of the iliac crest and then the lowest palpable rib, and you take the measurement in the midline of it. It's typically right above the belly button. So we did that, so it's about right here. Okay, we've got that measured. It's at 28 inches, so right there, okay? And then the next measurement is going to be the hip measurement. And it's got to be taken in the hip area, the largest portion of the buttocks. So you'll take it and measure it around, wrap it around about here, and go all the way around. Pardon my reach. And it is approximately 37 inches, okay? All right, and that is how you perform the waist to hip ratio measurement.
Okay, now we're going to demonstrate the anatomical position. It begins with standing upright in a standing position. Feet and face are pointing forward, and the arms are hanging by the sides with the palms facing forward as so.
Okay, now we're going to demonstrate the directional terms. First, we'll start with superior and inferior. So we're going to say that the knee is superior to the foot, which is inferior. Our next comparison is going to be the anterior and posterior. For this example, the quadricep is anterior to the hamstring, which is posterior. Our next comparison is going to be medial and lateral. Medial is when the arm is moving towards the midline of the body. The lateral is when the arm is moving away from the midline of the body. Our next directional term comparison is going to be the proximal and distal. The proximal is the shoulder compared to the distal, which is the hand. And last, we're going to compare superficial and deep. Superficial is the epidermis and compared to the dermis, which is deep. Okay, now we're going to demonstrate the different planes. The first one is going to be the sagittal plane. It divides the body into the left and right sections as so. The next plane is divides the body into the medial and the the superior.
Go ahead.
Stop it. Now we're going to demonstrate the planes of the body. The first one is the sagittal plane, and it divides the body in half into the left and right sides as so. The second plane is going to be the frontal plane, and it divides the body into the anterior and posterior sections like so. The last plane is the transverse plane, and it divides the body in half between the superior and the inferior sections like so. Okay, now we're going to identify the axes. The first one is the mediolateral axis, and it passes horizontally from side to side like so. Like so. The next axis is the antero-posterior axis, and it runs horizontally from front to back in this direction. Like so. The last axis is the superior-inferior axis, and it passes up and down like so. Okay, and now we're going to identify the center of gravity. This point is where all cardinal planes pass through, and it's typically about 10 centimeters below the navel. It's somewhere in this area, but it's about right here.
Now we're going to demonstrate motions in the sagittal plane. The first one is flexion. And see how the angle is getting smaller as she brings her arm up. That is flexing the muscle. Now as she brings it down, notice the angle gets bigger. That is called extension. There's also another motion in the sagittal plane known as hyperextension, but we are unable to show it at this time as it causes damage, but it is when the joints are moved at an angle that is not natural to the state. So she would, for hyperextension, the arm would be moved down below compared to what a normal movement is, no further than that. Two additional motions in the sagittal plane are the dorsiflexion and plantar flexion. For the dorsiflexion example, the ankle is bent up towards, and the toes move up towards the shin. For the plantar flexion, the toes and ankle bend downward towards the sole of the foot. The next motions we're going to describe are in the frontal plane. The first one is abduction, is when a limb, such as the arm, moves away from the center of the body. The next movement is adduction, is where a limb, such as the arm, is bringing down towards the center of the body. The next move is going to be elevation of the scapula, which is the lifting up of the shoulder blade towards the head or shoulder. The next motion is going to be depression of the scapula, which is bringing down the shoulder blade towards your feet. The next move is going to be eversion, where you will move your foot outside towards the outside of the body. The next move is going to be inversion, is where you bring your foot towards the inside, towards the center of the body, like so. Finally, next we have deviation. The first one is called radial deviation, where your wrist is bending towards the direction of your thumb. And the other deviation is ulnar deviation, is where you are bending your wrist towards the inside, towards the direction of your pinky finger. Last, you have lateral flexion, is where you will bend your torso sideways, like so. Next, we have motions in the transverse plane. The first one is rotation to the left. Next is rotation to the right. The next one is internal rotation. And then we have external rotation. Next, we have protraction. Next is retraction. We have pronation. And then we have supination. For our next motion in multiple planes is going to be circumduction, which involves flexion, extension, abduction, and adduction. The example is going to be demonstrated where you stick your arm out. Yes. And it creates a conical type motion. Our next motion in multiple planes is going to be pronation of the ankle, which involves dorsiflexion, forefoot abduction, and subtalar eversion, like so. The next movement is supination of the ankle, and it involves plantar flexion, forefoot adduction, and subtalar inversion, like so. Our next example of movement is going to be an open skill. This is a skill that must be altered because of changing dynamics such as activity, environment, or the object of interest. For example, we have mountain biking. The environment changes, therefore the athlete must adjust accordingly. Our next movement example is going to be a closed skill movement. This is a skill performed under standard environmental conditions. For example, we have archery. The archer is going to draw his bow and compete in competitions that have set distances in which the arrow needs to be released in order to hit the target. Our next example of movement is going to be motion, which is a change in position with respect to spatial and temporal frames of reference. And please note that no motion occurs without force. Of that movement, we have translation, which is when the motion is moving along one of the X, Y, or Z axes, in which all points of the system move at the same time in the same direction
with respect to the defined reference frame. Of translation, there are two sections. The first one is the rectilinear translation. Also, the path of the system is in a straight line, which is an example of walking in a straight line as the subject is doing so. We also have what we call curvilinear translation, in which the path of the system is a curved line. For this sample, we are going to have the subject perform a jump. Okay, and then there's also another type of movement, and it is called rotation. Rotation occurs when the system is restricted to move around on a fixed axis, therefore in a circular path. An example of this is going to be the head rotating. The base of the neck is what we consider the axis, and so the head rotates in a circular motion from that axis. And last, we have general motion, which is a combination of translation and rotation. So an example would be walking in a straight line while rotating the head back and forth, like subject is doing. Most human motion is general motion. Our next example is going to be a discrete skill, which is a movement with a definite beginning and end point. For example, a tee-off in golf. Our next skill is going to be a continuous skill, which is cycles of motion performed repeatedly with no well-defined beginning or end, such as jogging. Our next sample is a serial skill, which is a movement that appears to be continuous, but it's really a combination of discrete motions. For example, a tennis serve. It starts with throwing the ball in the air, which is one action, and then hitting the ball, which is another action. So it is a combination of two, making it a serial skill. For our next example, we have the kinetic chain, which is a system of linked, rigid bodies subject for force application. There are two types. The first is the simple kinetic chain, which is in which each segment participates in no more than two linkages. For example, you have your leg, which is linked to your foot and torso. The next kinetic chain is a complex kinetic chain, which is a segment is linked to more than two other segments. For example, your torso, it is linked to your legs, your arms, and your neck. For our next sample, we are going to demonstrate the open kinetic chain and closed kinetic chain. For the open kinetic chain, the most distal segment, which is your hands or your feet, is free to move. For example, jumping jacks. Your hands and feet are moving during this activity. For the closed kinetic chain, the most distal segment is stationary. For example, we have a squat. Your feet are stationary on the ground and do not move, like so.